September is National Recovery Month. We are talking today to Alicia Ventura. She is the Director of Special Projects and Research at the Grayken Center for Addiction at Boston Medical Center. Hi, Alicia.
Hi, very nice to be here.
It's nice to have you. Let's start right off. I feel as if in 2017, the opioid epidemic was the only headline that anyone read, and rightfully so. So what are the greatest recovery lessons to extract from the opioid epidemic as from those years?
We know what the evidence-based treatments are, and expanding access to them is extremely important. We know that there is not nearly enough access to meet the demand. And that's really important that we are able to expand access as much as we can, especially to rural communities and places that are very underserved. And coming up with new ways of supporting people and getting them the care and the resources that they need. The more options that we have to offer individuals, the better.
So have there been any innovations in recovery treatments in the past few years?
Yes, there have been innovations, and I think a lot of the innovations have had to do with the way that services are delivered. I mean it both literally and metaphorically. So people are both being met physically where they're at by innovations such as taking mobile vans out and reaching people where they might not otherwise being able to be reached. And then also meeting people where they're at, meaning, when they might not be ready to move on to the next stage or start treatment or anything like that. And people being okay with that and reducing the risk of harm wherever they're at, which has not always been the case. And that has been innovative in that, really trying to spread that throughout the addiction treatment community and getting the rest of the medical community on board and helping to support that, which, is obviously still in the works, but it's something that more and more people are getting on board with.
So let's talk about the effect of the pandemic on this community, because it's got to be so hard.
Because of stay-at-home orders, right? People are not able to connect with their peers and supports the way that they might normally, which increases their risk of overdose. There may not be someone else available or in the home if they are to have an overdose to revive them or to call 911, which increases the risk of a fatal overdose. Additionally, the drug supply, we have reason to believe, became very unpredictable during COVID or during the height of the COVID epidemic, which would increase the risk of overdose if somebody was to use. Also, access to treatment became a lot more sporadic as some treatment facilities closed. And we know that overdose risk increases once people stop opioid agonist treatment or their treatment's interrupted.
So have you seen the results of this in your work? People really struggling that much more and a higher rate of overdose?
So I can't comment on that specifically because I don't have those numbers. And Massachusetts has not yet released the second quarter numbers, which would really be where we'd see that data, or we'd see the increase in overdose deaths, though I think about 20 states have released data, and all of those states have shown a pretty significant increase in overdose deaths, some of them really quite traumatic and devastating.
So could you just also touch upon the, you mentioned the drug supply, you're seeing that it is looking more risky. Could you talk about that a little bit, what you're seeing in the streets?
Sure. So similar to when fentanyl appeared, because of the both stay-at-home orders and because there was a lot of there were a lot of travel restrictions put in place, right? It was more difficult to move product or drugs, across state lines or just move it in general. And so what happens is dealers will look to, uh, what's the easiest way to move drugs from one place to another. And the smaller they can package it, the better. And so if you can come up with a substance that is way more potent and then, cut it with something else, that's your best bet. And so, um, opioid analogs such as fentanyl or maybe something else require much less space because they're so potent, and so they can travel much more easily with that.
So this was something that you started to see in the spring with the pandemic, that the drugs were that much more
So
potent?
yeah, so this was something people were reporting, just that the supply was much less predictable, and this was something that people had experts had just predicted was going to happen. It's sometimes referred to as the iron law of prohibition. Um, it's something that we just see happen. There's where there's demand, people will come up with a way to provide supply.
Well, lastly, do you feel as if there's been a cultural shift in the perception of drug use?
Yes, so I feel like there is less stigma um, around addiction. We still have a long ways to go, but certainly things are being talked about in a much kinder way than they have been previously. I think that some of that has to do with the fact that addiction or the opioid epidemic is now impacting white middle class communities. Whereas historically, if we look back at the crack epidemic, it was impacting Black communities. And so the response to that was a carceral one. Whereas with this epidemic that has a white face, we are responding with more of a empathic and healthcare response and less stigma and not as much of a carceral response. And so I think it's really important to acknowledge that, and also that there are still very strong healthcare disparities that exist for our Black and brown brothers and sisters. But I do feel that overall the stigma is decreasing. The way that we're looking at things is decreasing. But like I said, there's still a very long way to go.
Well, thank you so much for sharing your work with us and educating all of us more on this really important subject that is everywhere.
Thank you. Thanks for having me.
Thank you.